There's a prescription drug abuse problem in this country that is truly epidemic. Too many families across America have lost loved ones as a result of prescription drug abuse. And joining me now is Robert Sines, who's making it his life's work to educate doctors on safeguarding their patients and themselves. And also joining me, Dr. Barbara Zeller. She's the Chief Medical Officer of Health Centers here in New York City. Good to see both of you.
Thank you.
So, Robert, I want to start with you. You were a former FBI guy, right? Border Patrol.
Department of Justice, yes.
Right, so you have quite an extensive history in law enforcement, but this is kind of personal for you. What's that about?
Well, as you said, I've been educating doctors on safeguarding their practice and becoming more profitable at the same time, specifically focusing on prescription drug overdoses and monitoring your patients closer. And but a couple of months ago, I lost a family member, a brother-in-law, who died of a prescription drug overdose.
Right, because it's such a huge, huge problem keeping track of these medications. Why is it so hard to keep track of it, and what are we doing about it?
Well, many times patients, because we trust our doctors, obviously, sometimes patients see too many doctors. And in the process of seeing too many doctors, you receive different medications. And so I always stress to patients and doctors, try to monitor closer. If you're a patient, it's best if you can just get all your medications from a doctor. And I'm specifically referring to pain pills, antidepressants.
Right, but Dr. Zeller, sometimes this can be kind of tricky, right? Because patients go shopping to doctors, and one doctor wouldn't know what the other doctor's giving.
The issue about knowing what people get is very, very difficult. We ask our patients, they will report what they're on, but we don't yet have the kind of electronic medical information that will be able to tell us what someone has been prescribed by another doctor. That's just arrived in terms of some of the controlled substances, but for all their medications, it's still hard to get.
It's very hard to get. So let's talk about that new program. It started here in New York recently. It's called iStop. Tell me how it works.
Well, these programs are actually in effect in many states across the country. What makes New York unique is that it's mandatory in New York for doctors to actually check a system. It's a state database where you can verify if your patient is receiving medications from another doctor, which doctors, so that you can compare or make a decision if you're going to prescribe a certain medication to your patient.
So in other words, if a patient comes to my office and says, I'm here because I need a refill on my prescription for whatever controlled substance, I can go on the database and find out right away when the last time was that person got that medication. So, Dr. Zeller, is this something that's going to be national? Are we going to see this soon?
I think we will. I should just state that we have to go on those websites. It's mandatory. Within 24 hours of prescribing that medication, we need to check it, which at the moment it's a burden on us, but I actually appreciate it because we treat a lot of people with pain disorders and substance abuse disorders in our practice. And it's very important to get the information. So we have incorporated it since it started on the 27th of August, and we really do appreciate the information.
Right.
We see all the controlled substances over the last 6 months that were prescribed.
Right, all controlled substances, which can be a lot of medication. So here's the thing, a lot of doctors are complaining, say, you know what, this is just another regulation, more oversight. How does this help doctors? They need to understand how it can help them. How does it help them?
It's helped us. I have to tell you, it's helped us. It's when we are concerned that someone is either having behaviors that are seeking opioids for addiction or for diversion, for sale, we can look and see if they've doctor shopped. And we are very interested in keeping people alive and also treating pain appropriately. So having that database lets me be able to say to the person, if they're doctor shopping, I can't prescribe under these circumstances. What else can we do? It appears that you're, misusing the drugs. What kind of treatment programs? We screen for substance abuse. So I find it a burden, yes, and it's very new. So we're going to have to see the burden.
Right.
But we have a big number of people in our practice that this is very useful for.
Right, because Robert, that's what this is really about. This is your whole mission here is to save lives. So what happened to your brother-in-law doesn't happen to other people.
Yes, and it was a sad irony, tragedy that it happened to me. And the point is, it can happen to anyone. Many of these people don't intend to die. Many of these are accidental. You take an opiate with a benzodiazepine, a painkiller with an antidepressant, you stop breathing. And if you stop breathing at night, you die. And so it's imperative that doctors do their part to monitor their patients, educate their patients. There's also a personal responsibility. As a patient, you should communicate with your doctor. Try to get your medicines from one doctor if possible.
Right, and people have to understand that this is not just your average drug addict on the street. This can happen so easily with so many of these prescription medications. They're very, very dangerous, and they should be watched closely. Robert Steins, Dr. Barbara Zeller, thanks so much for coming in.
Thank you.
Really
Thank you,
appreciate
Dr.
it.
Steve.